Yes, we are at Summa Health, and we are keeping with the policy, keeping our masks on. I am spending some time with Dr. Aliaksandr Ramaniuk, who is joining us right now. We're talking about COPD. We hear those initials. Doctor, what does it stand for?
Now, Joe, COPD, or chronic obstructive lung disease, is not just one disease. It is a spectrum of disorders that relate to obstruction of getting the air out of the lungs. Okay, it is common. It affects up to 6 to 10% of the global population.
Wow.
It is treatable, it is preventable, and most importantly, it's manageable.
So what causes it? You say it's preventable, so what can we do so we don't get COPD?
COPD has a variety of risk factors. One of the most common risk factors in the United States is cigarette smoking.
Okay.
But there's other factors as far as environmental risk factors, occupational risk factors, toxic exposures, even anatomical and genetic risk factors that can cause chronic obstructive lung disease. And it's also associated with a variety of other comorbidities, as well as asthma, bronchiectasis, pulmonary fibrosis. And we must be very specific and very dedicated in diagnosing and treating it, because it is the #3 cause of death globally.
What are some of the new advanced treatments for dealing with COPD?
Joe, to treat advanced COPD, it is not just one treatment.
Okay.
It requires a systemic approach by a group of designated professionals. And it requires perpetual reflection, perpetual improvement. We must focus not just on bronchodilator therapies, which open the airway, but also to provide oxygen or non-invasive ventilation for people that need it. We must focus on providing pulmonary rehabilitation, smoking cessation, cancer screening, and some of the more novel and advanced therapies, such as lung volume reduction surgery, or even more novel bronchoscopic lung volume reduction that we're going to be offering here at Summa Health as well.
Let's talk about here at Summa Health what you do have to offer, because there's a lot of options.
Now, Joe, Summa Health is at the forefront of advanced COPD management. And the reason for this is that we have, one, significant institutional support from our senior leaders. We have departmental support under the leadership of Dr. Brian Bauman, who's created a team of designated professionals, front office staff, nurses, advanced practice providers, physicians, and a team of medical professionals to provide care on all aspects with all the modalities that we've spoken to before.
There's a lot of options to choose from. And this is the place to go. You
Yes,
said
sir.
You're one of the leaders. That's awesome.
At Summa Health, our goal is to not treat COPD as a disease. It is to treat the individual in our community with the most advanced and novel therapies to provide the best care for them to be able to breathe and have a good quality of life.
Well, if you want more information, there is a lot to be had. I'll tell you, just go to their website. It's summahealth.org/COPD. Doctor, thank you so much for your insight and all that you do. We appreciate it.
Thank you very much.
This segment of Good Company was sponsored by Summa Health.